So we cover the different types of discharge that you might be seeing. So when you're deciding between our fertile and infertile days, we look at our cervical mucus. So we went over in the other video the different types of fertile mucus that you could see. So if you're not trying to get pregnant, you would use protection or abstain there. And then if you are trying to get pregnant, that is your time. So the days that you would be deemed like infertile would be our dry days. And this can look different person to person. In general, you are feeling dry. You're not always gonna feel super dry down there. It is a mucous membrane, remember? So it's gonna have a little bit of something. So if you were to have clean hands and insert, you're going to get something. And that's why we prefer external checks. So after your period, you can get a handful of dry days before your body starts to make that cervical mucus as your estrogen rises. And what this looks like, again, it's gonna be different per person. You might have this like dry, tacky discharge. And notice how it's not clear, definitely not stretching. It's certainly not lubricative. So this has like not much moisture to it. If you rub your fingers together, it kind of balls up and it's definitely dry. And again, we're not having that moist sensation down there. It also might just look like that, just like a little something. And what that little something could be is like cellular slough from your cleaning mechanism. It also could be G mucus from the residual progesterone from your last cycle as well. Another thing you might see on a dry day is just a little bit of like moisture. But really the air is quickly dissipating it. It's not lubricative at all because remember it's a mucous membrane, so you might get a little bit of like wetness. You might not feel completely dry, that's completely normal. So you might just get a little bit of like shiny or like wetness on your finger. And then with your toilet paper, when you wipe, you could see a little shiny spot and that can be completely normal as well. It can take some time to kind of dictate between a dry day and your fertile mucus days, but with practice and over time, you will get the hang of it. Just take your time with it. Maybe just look for like sensation, get in the habit of checking. Then you can move into charting like different things you see, whether it's like lotiony, lubricative, if it's clear or stretchy, or if you're getting those dry days. It can really speed up the process and make you feel a bit more confident if you do work with a fertility awareness instructor or if you take a course. I do have a free FamWise guide in my bio, so you can check that out. And I have a course launching soon as well, which I'm super excited for. So stay tuned for that.